Glad that you're here today as we have the final press conference for the year. It's hard to believe it's coming to an end this year, 2020, but I'm certainly sure everyone is ready for 2020 to be over with. What we thought we would do today is talk a lot about, or as much as we can, about the vaccinations, because I think that's one of the big questions that most people have today is what is going on with the vaccinations. But first I want to offer the following comments, and that is that we continue to want to ask people that if they have symptoms or if they think that they have been exposed with someone who has been tested positive, that you seek a test as soon as possible. And if you start to have symptoms, that you too also seek medical help as soon as possible. What we don't want to do is to create an environment where people are nervous to get tested and nervous to seek medical help. I care a lot about each of you as citizens. I care that we all survive this. We know that there's many of us who will survive it with no health impacts, but that's not true of everyone in this community. So far, through yesterday, we've had 214 deaths in the Tom Green County area, or our K area as we call it. And so we know that families have been impacted, that many have been emotionally impacted, financially impacted, and had to deal with deaths. I know I've had friends who've been tested positive and had tremendous negative response to the COVID and have had to seek medical help and are dealing with health issues that they never thought that they would have to deal with. So again, we ask that all of you who have loved ones, family members, friends who have been exposed, let's be honest if we've been exposed. Let's be honest if we've tested positive and make sure that we care enough about our fellow citizens that in fact we are honest with that diagnosis and that we care enough to ask that our loved ones seek medical attention as quickly as possible. With 214 deaths, certainly it's a number that I don't think any of us thought we would reach 4 or 5 months ago. So it's sort of a shocking number. We did so well as a community as we came through the Thanksgiving holidays. People obviously did not get together as large families, really cared enough about their loved ones that they didn't gather together to celebrate the Thanksgiving holiday. But obviously the numbers that have come out over the last 3 days would indicate that that same mentality has not existed through the Christmas holiday season. In 3 days, we've had 623 positive cases. From this past Saturday, the number of people in the hospital have gone from 86 to today's 103. So it's a pretty dramatic increase in terms of hospitalizations. So today, what we really want to talk about is pleading for people to avoid gathering in large gatherings and to make sure that through this New Year's Eve celebration that we pay attention to who we're with, how we are or who we are spending the New Year's Eve holiday with. We don't want these numbers to continue. We are one of the few districts right now who have not had to deal with the 15% factor, and we would like to continue to have our trauma area be one of those areas that do not have to respond to a 15% hospitalization number. But as we've said before, it is up to each and every one of you to do your part to make sure that the numbers continue to decrease, or that they reverse from the increasing numbers that we have now and we start to create a more decreasing number. Certainly Christmas is a season of family, but we don't want to infect our families, and obviously we've had a big impact with families being impacted and being tested positive. We ask that you really reconsider many of your holiday parties or who you're partying with, or where you're partying, and that you make sure that you're in an area where other people are as concerned about your health as you are. So we're going to go ahead and move now into the vaccination subject. You know, Shannon initially had 1,700 doses. They started giving those doses out on the Tuesday before Christmas. And so I think that was the 22nd or 23rd of December. They have received another 975 doses. I believe they got those maybe last Friday. Does that sound right? So last Friday. So they are in the process of giving those vaccines out, and they've also been given Moderna vaccines. We believe about 1,000 Moderna vaccines. So I'm going to sort of ask questions and then answer, and hopefully we'll address some of the questions that you might have had. So who requested the first doses from the state? All right, various healthcare providers requested doses, but the key factor on early adopters was having the ultra-cold capacity, which Shannon was able to put in place, and that means the freezers that could take that low temperature that was necessary for the Pfizer vaccine. The second question might be, were the second batch of doses given to us because we had used so much of the first one? The answer is the key to receiving additional doses is by utilizing your initial allotments. For example, the state will not send additional doses until you have utilized the initial allotments, which Shannon Hospital did do. How much of the Moderna vaccine will we receive and when? On 12/29, 2,600 doses were received by Shannon. And I believe others like H-E-B, Walgreens, and CVS have also received Moderna doses, but we are not aware of their actual numbers. When do we anticipate more vaccine shipments? Well, we are not aware of the next shipment. The information is provided on a day-to-day basis. The next question, what phase are we in? If someone qualifies for phase 1B, how should they go about getting vaccinated? And our answer to that is we are working on a process to better coordinate the 1B vaccination process. The city and Shannon are scheduled to meet on Monday to discuss our vaccination plan and how best to move forward. We will update our vaccine web pages as more information becomes available, and that is on cosatx.us/vaccine. I am going to step away a minute and let Judge Floyd come up and offer some comments, and we'll go from there and then take some comments or questions from you all.
Thank you, Mayor. Yes, several points. First, I want to thank the citizens of the community for about a month ago, we were concerned about the 15% rule. Through your efforts, for a month we stayed relatively in a safe zone. In fact, the last 2 or 3 days, we were basically the lowest trauma region in the state. Now, the last 2 days, that has changed significantly with a spike here. And I don't know what the other areas are doing. I know they are struggling too, but we need your continued diligent efforts to try to stay safe. We are at a critical junction. We have the antibody therapies that are being utilized. I continue to hear good positive outcomes of people that are avoiding the hospital with Regeneron and the other BAM-BAM treatments, I think that they call it. Obviously, the vaccines are rolling out as quickly as the state can get that done. And I'll follow up a little bit with that. But it still doesn't change the fact this morning or this afternoon, you notice Dr. Veredis is not joining us today. It's because of the activity currently going on right now in the emergency room. Our acute bed count is at critical stage now. There's still bed capacity available, but the acute bed capacity has just nearly been utilized. So this is a critical time, so it's going to take some extra effort on all our part and some prayers to avoid any further problems. The vaccine situation, the mayor gave you a very good update. It is an extremely fluid situation. There was a conference call from the state yesterday. I got off one at noon today with the regional health director, Dr. Soni. There is a 17-person panel that is continually evaluating that priority and the allocation per region because of the numbers that are changing, various things. It's fluid. To give you an example, Group 1B originally from the CDC guidelines contained teachers. That got pivoted by the state yesterday to over 65, specifically if they have any underlying conditions. But I believe that the mayor has some information that Dr. Hellerstadt says that there is some criteria that let no vaccine go to waste. So Shannon is doing a very good effort, but the rural areas of which in our Council of Governments region, I speak with those county judges, They're a lot of times have volunteer EMT staff, that sort of thing. They are scrambling for the logistics to try to get the vaccine to their community and somebody to administer it. With obviously the holidays and now potential winter weather mix could affect some of those deliveries. But the state has really got all hands on board, the state health department and the Texas Department of Emergency Management, trying to put as many of these vaccines in the community, spread out to those they need them as quickly as possible. I have to commend their efforts. And also, Sandra Villarreal in our city county health department has just worked tirelessly. Dr. Veredis has been a great partner, and obviously Shannon Health System. So anyway, that's about all of my comments, Mayor, if you'd like to finish up.
I think the one comment we want to add is that, yes, the vaccines are out there, and yes, people are starting to get them. But right now, just because the vaccine is out there does not mean we need to stop doing the right thing, and that means making sure that we follow CDC guidelines. The vaccine is out, but it's not going to everybody right now, and it will be some months before all of the citizens of San Angelo who want the vaccine will be able to get it. So it's not time to let up on our consistent care and passion for our fellow citizens, families, neighbors. We all need to continue to follow the CDC guidelines and make sure that we as a community stay as one of the healthiest communities and trauma areas here in the state of Texas. But it will take every single citizen's efforts to ensure that that happens. The vaccine is great. We're excited about it. We're excited that Shannon has done a great job of getting it in the arms of people. But it's a very small percentage of the people in this trauma region. So we're going to open it up for questions. I'm sure you have some in addition to, and I can certainly go back over the questions and answers that we offered earlier. So please, if you'd like to ask a question, raise your hand, come forward to the microphone. Yes, Joe.
Imagine that.
Joe Hyde, San Angelo Live. Bloomberg has an article this morning, or maybe it was yesterday, talking about how warp speed at 200,000 vaccinations a day is not warp speed, and they mentioned that Texas is about 18% utilization of their vaccines that have been delivered. Do you have any idea what the percentage number? I mean, you kind of talked to that a little bit, but what do you think the percentage number of vaccines that have been delivered that have been administered in Tom Green County?
In the meeting that we had yesterday, they came up with a 20% number that they thought had been administered. But as they said, there are many factors that play into that, and they weren't sure that that was an actual number. So I don't think they have a real good handle on it. Steve, do you want to, after your call this morning, add to that? But I know that was the number they threw out yesterday.
Yes, I think part of it has to do with the region that they're in, and the purpose of the call yesterday was to clarify some things, is that just because somebody is standing there, that's not a 1A. If you have vaccines that are going unutilized, especially ones that are going to spoil, then please get them in an arm to someone, preferably in this risk category moving forward. So I think part of that was yesterday the call was to give some additional guidelines for those that are administering the vaccines because of some concerns such as that. If the first rollouts, they may have overloaded certain areas, unsure of what the absorption rate was going to be in that community. And so I think they're making those adjustments daily about where to send those where they are getting utilized. Some areas evidently are a lot more receptive to it than others. So.
But we will say in our region, the reason Shannon got another 975 Pfizer vaccines was because we used up our original amount. So we are a county or region, trauma region, that has utilized all that we've been given. That's why we got another 975.
One of the issues with getting a vaccine is a lot of people don't know how to get one. So who's administering? You mentioned Shannon, obviously, but HEB, some of the pharmacies and things like that. Do you have any kind of idea?
Well, number one, particularly the Moderna, was the vaccine that HEB and the CVS and Walgreens was giving to assisted living and/or healthcare, retirement homes, nursing homes. So they are the ones responsible for that. Shannon did go out into some of the surrounding counties over this past weekend, and were able to give over 100 doses to some of those areas that did not have health care providers in those areas. So we are doing everything in this city to get our vaccines in the arms. And certainly we've used the tier that they ask us to do, but if that tier, let's say if all the healthcare workers or all the police or all the fire have chosen not to get the vaccine, we're opening up the window for others to get it. For example, I believe that we're asking the dental offices, because they're always in your mouth and in your face, that they ought to be considered part of that first tier of healthcare workers. So we are evaluating it, but we in this trauma area are going to give out all of the vaccines we're given. And we will be updating you. As I said, you have this web, COSATX.us/vaccine if you want additional information about how to sign up or when to sign up or when your tier might be available for that vaccine.
Follow-up question to that. I'm a plumber. I make 45 grand a year. I'm not on Medicaid. My family's not on Medicaid. I don't have health insurance. What is this going to cost me?
I believe the answer is zero. Great things that they've put out there on this vaccine is it is something we believe is the right decision, the right of every citizen to have it, irregardless of income or health insurance.
That's all I have. Thanks.
Other questions? Comments? Okay. Thank you very much for being here again. And if any of you want to do one-on-one interviews with Judge Floyd, myself, or the city manager, Daniel Valenzuela, we're certainly willing to do it. We want to make sure the citizens understand everything that's going on, that we want to make sure the citizens understand New Year's Eve is a crisis event. 623 new cases Monday, Tuesday, and Wednesday. It's a lot of new cases. And if you look at the positivity rate, it's almost 23%. So if you take a look at that 23%, it's a big factor. And our hospitalizations are going up at the same level that the number of positive cases are. So we need everyone to be fully aware of what's happening.
And one final comment on that. To share with you everything that we know as we know it. As fluid as the situation is if you see this now and it gets reported tomorrow, a lot of times there's a good possibility that has evolved or changed some. And that's what we're getting, because nearly daily we're getting information, and it's fluid and it's changing. So we'll tell you what we know as we know it when we know it. But that doesn't mean it's going to stay like that very long, but we will certainly update you as we find out.
Without a bang, right? Yes.